Hi, welcome to Pharma Line. This is Suresh K. Boganatham again. Today in this session I am going to present various roles of the pharmacist in Canada, stepwise procedures how to become a pharmacist in Canada, and various immigration pathways, and if you are willing to migrate to Canada on a student visa, what courses are the ideal in order to be successfully complete the pharmacist licensure exam. With that said, who decided to take the Canadian pharmacist licensure exam? It's a great decision, so congratulations on your decision. There are two levels of exam. First one is the PEBC evaluating exam or the equivalency exam. Then second step, PEBC qualifying exam. And after PEBC qualifying exam, there's two parts. One is the MCQ, the first part, and the second one is the OSCE, that's Objective Structural Clinical Examination. Once you clear these two exams, then whichever the province you want to practice, you want to do the provincial dispensing law examination separately. So there's many steps involved in the process. The first step is registering on the pharmacist gateway. Once you register on the gateway of Canada, they'll assign you the national identification number. This national identification number will help you to track the progress of your application throughout the process. So this is the first step. To do this step, there's 340 Canadian dollars you need to pay plus tax. Second one is the pharmacist evaluation of the documents with the PEBC, that's the Pharmacist Examining Board of Canada. So in this step you need to submit your original degree, transcripts, your ID documents such as passport, and then the certificates of good standing, that's your registration within the state. So those documents they'll evaluate. If it's the college is certified by All India Council of Technical Education, this process is really easy. And then after they evaluate everything, then they'll give you the educational competency assessment, which is also known as ECA in short. So these two steps are the basic steps even on the PR process. So once this thing is done, then you'll go to the PEBC evaluating exam. This is all international graduates have to undergo this PEBC exam. This will measure the competency levels of the international pharmacist versus the Canadian graduates, whoever graduated in the final year students of the Canada. This exam has a multiple choice and it has 200 questions, and the duration for this exam is 4.25 hours, and the minimum score in order to pass in this exam is 60% you need to secure. This exam will be held 2 times, one in the summer and the other one is in winter. That's the January and June respectively. And the fee for this exam is $670. And the blueprint for this exam mainly, it's all 4 years bachelor subjects like biomedical sciences, pharmaceutical sciences, clinical sciences, social, behavioral, and administrative sciences. Basically, it's all like B.Pharm 4 years subjects. They'll evaluate competency against the Canadian graduates. Once you qualify for this exam, then it will open the doors towards becoming a Canadian licensed pharmacist. So once you pass the evaluating exam, next step is the Canadian licensing exam, which is a first part. It have two parts. Part 1 is the MCQ, which is all multiple choice questions, and part 2 is the OSCE, which is a objective standard clinical examination. So the first one, MCQ, has 150 questions and it's 4.5 hours, and then it's criterion based pass or fail. Depending upon the difficulty level of the examination, they'll assign certain number of questions to be evaluated. Each year it differs depending upon the difficulty of the exam. Blueprint for this exam, mainly the therapeutic sciences, where they'll focus more on disease state conditions like hypertension, cholesterol, diabetes, all case studies and the management. And then there's also pharmaceutical product development, product distribution, research and communication skills, education skills, and then it also focuses on the interprofessional collaboration, because the pharmacist has to deal with nurses and psychiatric technicians, social workers. So they'll measure the inter and intra-professional collaboration, as well as the quality and safety effectiveness standards also will be measured. There's no set score, but it's a criterion based score. So each year they'll individually set the passing score on this exam. So once you finish this MCQ, then it will be objective structural clinical examination. It's kind of like a practical examination. On the other MCQ, they measure your subject, but its other one is the objective based. So they'll give the clinical scenarios. Actually, the examiner comes and acts as a patient, and then you have to solve the clinical based questions. Each station has 7-minute time limit, and there's the interactive based, 10 interactive based case scenarios and 2 non-interactive based case scenarios. There will be a specific standard. It's kind of open book exam. You can able to access monographs and other reference books, but you need to know how to solve and how to respond to the examiner. Sometimes the prescriber can ask you questions like, if patient is allergic to penicillin antibiotics, which other antibiotic or alternative you'll choose, and what will be the treatment plan, what dosage, such kind of questions. So it's basically you need to have whatever examiner is looking for. There's a clinical standards for the specific station. So instead of by hearting, you need to know the practical assessment part. Because in India mostly it's a industrial based courses. So you have to focus most on therapeutics on this one in order to be successfully complete the OSCE. So once you finish the MCQ and the OSCE part, now you can go to the provincial examination part, which is administered by the provincial colleges of pharmacy. In Canada, there's 10 provinces: Alberta, Ontario, British Columbia, Nova Scotia, New Brunswick, Manitoba, Quebec, Yukon, and Saskatchewan. So each province has their own specific requirement on the dispensing laws, as well as the code of ethics. And each exam for this one, it varies from 125 to the 300 Canadian dollars. So on the provincial college requirements, there's bridging courses also mandatory in some provinces, but not in all provinces. In British Columbia, you need to do the bridging course to build the gap between the Indian qualifications and the Canadian qualifications. That's what the bridging course is. So you need to pay 10,500 Canadian dollars for this bridging course. In Ontario, it's 13,500 Canadian dollars. But if you pass the MCQ part of the examination and then the OSCE on the first attempt, this can be waived so that you don't have to pay 13,500 if you clear those both exams on the first attempt. Otherwise, you need to pay 13,500 to do the bridging course. So afterwards, there's a language requirements also. IELTS or the TOEFL, but mostly Canada prefers the IELTS academic module you have to do, and minimum band score 7 you have to get. But if you did masters from the Canadian university, you can apply to the provincial college for waiving this requirement. Sometimes they'll consider your old score, but it's a discretionary. You can try, but it's up to them to decide whether they can waive this part or you have to do the IELTS. And then now I'm going to go to the immigration pathways. So first, if you want to come on a student visa, you can come on master's degree program. But to come on master's degree, you must demonstrate you have the research experience, or at least if you have the publications, that will help to secure the visa easily. But it's a little bit of cost involved with this process. Then there's another cheaper option to do is the enrolling PG diploma course. Like under PG diploma, you can do for the pharmacist technician license. You can able to enroll. If you enroll in this pharmacist technician license, it's a licensed profession. There's a shortage for the pharmacy technician. So if you enroll this one comes under NOC B level. So after 1 year experience, you can able to apply for the PR, which you can get it easily. So since it's NOC B demanding position and license is required to practice, it's really preferable in this way. Instead of enrolling into management courses or the business administration side, the opportunities are very limited because Canadian system doesn't have much clinical hospitals. So basically, if you go to the chemical lab technician or pharmacy technician or the nurse practitioner, it will be more advantageous and the cheaper option. So if you are coming on the student visa, there's 2 years work permit, and then you can get the part-time work permit for the 20 hours per week, and 2 years study permit you will get. But if you enroll in 2 years course, then you'll get the 3 years work permit, as well as if you married, even your spouse can able to get the work permit. So one can be studying full-time, and then one can do the job, and then the part-time studying option, which might balance your budgeting levels. And then if you want to come on work permit, then it's a complicated process because it has to be announced by the labor market impact assessment, where there's only demand is there, only that profession can get the work permit. So there's no guarantee that everybody will get the work permit. So it's a risk-based, risk-associated option. And last one is the PR process. In this PR process, there's 3 different programs. Federal Skilled Worker Program, that's the first option. And there's a Provincial Nominee Program also. And then there's a Rural Northern Immigration Pilot Program. For all these programs, you have to clear the IELTS general module first. So depending upon your IELTS band score, your CIS score depend upon this score. So with this, you can get the more chances for getting the invitation. So that's all for today. Thank you.